I have a few videos to show you, and then we'll have hopefully like a really fruitful conversation that is courageous and curious. So I will start. I'm going to be moving between screens, so I'm sorry if it's a bit clunky because I'm now on a different computer, but I am going to share my screen. Okay, Courtney, do you have the whole thing up there, or is my whole desktop up showing?
I can see your screen that says Dignified Food Access.
Okay, great. So thank you for inviting me here. I love that you all are having these conversations. It's sort of the spirit in which this evolved up here in Thunder Bay. When we talk about food up here in Thunder Bay, and Courtney introduced with a land acknowledgement from where she's at, but for us, food is intrinsically connected to the land, and it's connecting to people's kind of self-determination to be able to access food of their cultures, their tradition, and that sustains their life. So up here in Roots to Harvest, we acknowledge that the land that we are on and our staff are on, our partners, our board, are the lands that have been held by the Fort William First Nation people, signatories to the Robinson Superior Treaty of 1850. Roots to Harvest is a settler-run organization in this area along the shores of Lake Superior. And we pay respect to elders past and present and the knowledge keepers in supporting folks to their own sovereignty, specifically around food sovereignty. And so that is who we are here. So today, we're going to talk about this handbook that we created, and it was super fun to create because it was really participatory. I'll tell you a bit about the process, how it came to be, and then some of the elements that are in it. But first, I'd like to locate myself and Roots to Harvest. So Roots to Harvest, we are a not-for-profit that has been in Thunder Bay, which is not North Bay, but Thunder Bay, which is geographically isolated. Our closest place would be Winnipeg, that is 8 hours, and then Sault Ste. Marie, which is 8 hours. So we really are geographically isolated, even though we are a major city of 120,000 and we have an airport. You know, we really felt that during the pandemic because a lot of our transport lines were cut off because it's not easy to just go somewhere else for an hour to pick up food or to get into the city. Most of our fruits and vegetables comes from Southern Ontario. And when the pandemic hit, they started coming from Calgary or Western ports, especially when things weren't crossing the border so much. Because we are 45 minutes from the Minnesota border. So just to locate us. We work in our organization, Roots to Harvest, we work in many different areas. We work in the schools and delivering food literacy programs in the schools. We work in employment and we hire folks over the summertime, and we do advocacy work around basic income and access to identification. Currently, it's not happened yet, but it will happen in the fall. So it's important to position us this way. We are becoming a community food center through Community Food Centers Canada. I think we'll be like the 15th one. As that repositioning is happening, food access is becoming a core new piece to what we're doing. We don't have a food bank on site, and our food access programs are more developed in partnership with communities around skill building and training. And so we've never been a traditional food bank or have those connections, yet we are going to be moving into doing more food access, which we do through community gardens, affordable food markets, but we'll get to that in a sec. We're in this kind of weird transition place. Also, just to note organizationally, you know, in 5 years, we've gone from 5 full-time staff to 15 full-time staff, you know, an operating budget of 500,000 to close to 2 million. So we're really shifting and we're growing super fast. And so we see this as a huge opportunity for us to be able to look and address the needs that are really happening within our community. And so just to kind of, you know, I think it's good to position where we are. You know, we run 2 urban farms and we support 2 employment programs for people who have lived experience with poverty, incarceration, consumer survivors, existing mental health and wellness challenges, intergenerational trauma, and addictions. We hire folks in a supportive environment 15 to 30 years old to run our urban farms. Now, you all live in this beautiful area where you're probably in zone 5A or B for growing food, and you have a long growing season. We have one chance. We have a 90-day growing season. We're in zone 2B. It's very hard to grow food up here, but we still try it. And this year, with all the snow that we have, I don't even know when we're going to be able to get into our fields to start that. So, you know, we're really connected to the land, and really we use food as a tool to build meaningful connections and to have conversations and to meet people where they're at. So it's about the food, but it's more about the connections and the relationships. We also do employment and training programs. So we look at who in our community is feeling socially isolated and maybe not included. And Thunder Bay within the last 5 years has had a real influx of newcomers. It has been a lot of the newcomers that have come have been economic immigrants that are coming for the hospital or for the university. But it started with the wave of Syrian refugees that came about 5 years ago. And since then, we're seeing more and more refugees that are making Thunder Bay their home, which is new. It's new for the city to be able to adapt to that and to figure out what that means. And so, you know, we have 160 of the Afghans that came under the Afghan initiative. We still have more from the Middle East that are coming. There's a bunch of the Ukrainians that are coming. So we are seeing more and more of this. And so Roots to Harvest becomes a place where people find belonging and a sense of place. And I think it's important to know these things because it's the approach that we took within our work. We also host affordable food markets, so comfort fruits and vegetables at cost for people in their community. So we actually go to communities. So this is our affordable food market in one of the subsidized housing complexes in Thunder Bay where people on fixed incomes can access these. So they're still paying a cost. It's the at cost for their fruits and vegetables, but we've been pretty successful in getting some grants to actually subsidize it. And we're actually having people who are part of this Greens prescription where their nurse practitioner, their doctor can prescribe them $20 fruits and vegetable per week, and they can come and access it at our affordable food market that happens once a week. We also host it in our neighboring First Nations communities. Thunder Bay is really unique in that we are home to 14 drive-in communities. So there's 14 drive-in communities, and then there's 40 fly-in communities that make Thunder Bay their home, which presents a lot of challenges and opportunities to be able to connect people with food. So this is a neighboring First Nation community that wanted to bring fresh fruits and vegetables for people, because if not, they have to drive 2 hours to Thunder Bay to get their food. And so it's at cost, it's once a week. And it's been super successful, and we're expanding those pieces out. And so when we're thinking about, you know, approaching food and the different ways that people access food, the new thing that's come up for us really in Thunder Bay with all of the newcomers is newcomer food access. And so this has also informed who we are and in this book. And, you know, we've started to address the needs. We're noticing that newcomers are coming and they're going to places to get food access, and none of it is culturally appropriate. None of it is diet foods that they would eat, like a can of, you know, pork and beans would not necessarily fit within their diet. And so we're also working with newcomers in terms of figuring out how to access food when folks are on a fixed income, living in poverty, and can access in a culturally appropriate and responsive way. And so I think all of these things are super important as a background for you to be able to understand where are we coming from and why did we do work around dignified food access. So when COVID hit and all of the granting streams changed, the Ontario Trillium Fund and the Resilient Communities Grant, we put in an application for them around this dignified food access project, because what we saw in the city of Thunder Bay during COVID is that folks, like, I don't think I need to describe this to this group, but you know, there is chronic food insecurity and then there's emergency food insecurity. And so what we saw during COVID is that the chronic stuff is always there, but the emergency stuff became front and center, and it became a place where people actually were having conversation. It also became the place where a lot of local places where people would access food programs closed down for a whole lot of reasons. And so we found that it became really challenging for people to access food. And I'm not sure how big it is in the area that you are, but in Thunder Bay, if people want to access a food program, be it a food bank, a community garden, a community kitchen program, they need to call and register with 211. And so by calling and registering with 211, if you've ever called 211, you know you call 211 and they send you to a central dispatch and then someone else calls you back. But what we found is that so many people, they didn't have a phone, or they didn't have minutes on their phone, or they couldn't wait 45 minutes, or they couldn't get a call back, or they couldn't access their food because they didn't have a phone. So there was this real digital divide that was happening. And so in response to this, we put in a grant to start a conversation around dignified food access, to know that we can do this better as a non-for-profit community, as a community that works in food access. And so we put a grant together to begin to start to have these conversations and workshop these ideas. So we had two groups. We had the organizations that were doing this work and wanted to engage in these curious conversations. So we had some Indigenous organizations, some daily meal programs, some food banks. We had Feed Ontario that was there, that Thunder Bay has, so those of you in food banks, are connected to Feed Ontario, but we have a local distribution called the RFDA, the Regional Food Distribution Authority, and they help to get food out to the member organizations. So Feed Ontario became the representative at this table. So that table in the working group was having conversations, as well as an advisory group. So these were people with lived experience accessing food programs. So we wanted to have conversations in these groups about how can we do this better? Food banks have been around for 40 years. They were a response to an emergency 40 years ago, and they're still in business. And so we're trying to figure out ways in which when people come to access food, they have already exhausted all other options out there. They've already borrowed food from their neighbors, from their families. They've already invited themselves to people's homes, that when they actually get to a point where they access food, that they are really at the moment where they need some support. And so these two groups got together and started having conversations, and they had conversations separate. And the conversations were around what are some of the key elements to include to make food access more dignified? And what would that look in our language, in our spaces, in the food choices that people have? And I was really struck by when we were with this advisory group, and I'm going to read this quote out because I think it really says a lot to how people, like where they're at when they access food. And this was someone who was in the advisory group and says, "I don't want to hang my dignity on the door on the way in and leave it there to get the services I need. And then I can't pick it up on the way out because of the way that I was treated inside." And that really spoke to me, because as someone, I have never accessed emergency food in my life, but I know I have been other places where I have had to hang my dignity on the door to get a medical service or to get financial support or whatever it is. And I know that feeling. And it already, when you're in a rough place, to have that feeling, it keeps a lot of people away from accessing food when they need it the most. And so we started having these conversations, and what came out of it was great and hard. It was messy. So much of the conversations had to do with our own identity in the organizations that we work in and the work that we do. Because people generally who are working in this kind of caring profession, volunteer work, however you define it, are people who really want to do good work. And so what we came to was that no one was discounting that we were all doing good work, getting food to people in various ways: community gardens, food banks, good food box, community kitchens, employment programs. But what we wanted to do was to challenge and understand why we were making the assumptions we were making, why we created the programs that we created, and how can we include the voices of people using the services and programs into the conversations. So we got together, we had conversations, we talked to different stakeholders, we interviewed each other, and we came up with this handbook, which I think it has been sent around. And so this handbook is meant for people in organizations that are ready to question and ask themselves, what does dignified food access look like? And so our goal is to build a community with food supports that in a way that looks, sounds, feels, tastes good. And so we came up with our guiding principles toward dignified food access, and they are of respect and trust, care and empathy, and non-judgmental support. And those things led us to all of the conversations that we had and ways that we want to approach the elements of dignified food access. And so through all of the different conversations, we came up with dignified food access includes these elements: quality food choices, the respectful way in which people interact, and the welcoming places. But then we were like, it's not just enough, actually, because if we realize that people who are food insecure and need community food programs and food access in the variety of ways, we also need that element, and everyone needs to be working on that element, either local or bigger, around advocacy. And what does that look like? So I'm going to spend the next little bit going through a few of these elements, because I think they are really good to help to understand where. So quality food choices. Quality food choice, it has various aspects. Safe, fresh, nutrient rich.
Yeah, hi. Airin, do you mind muting that individual?
I don't know how.
Okay, I just don't have.
I'm gonna try. Just give me one sec. I'm gonna try to find. Oh, I see them. I see the little dot beside their name.
Yes, thank you.
It's the dot, right? It's the dot that. Oh, there it is. I can. Got it. Thank you for being patient. Okay, so fresh food has two meanings. Fresh includes perishable foods such as fruit, vegetables, dairy, and meat, as well as fresh food is food that is related to specific diets that folks need. So it might be higher in vitamins or minerals or other important nutrients. We know that fresh food is hard, and I think that's where a lot of people get stuck, is like, where do we have the money to be able to buy the fresh food? And in our discussions with our group, one of our members from the Thunder Bay Food Bank has just said that's where all their fundraising, they realize the people that come, it's the eggs and the milk and the meat and the vegetables that really make the impact for folks, and that is where they're choosing to fundraise to purchase the fresh foods, and as well as the accompanying purchasing, the fridges, freezers, cold storage, all the stuff that comes along with it. The other piece of fresh that we think about a lot is in food that is the opposite of stale, wilted, expired, and moldy. And the other day I was talking to a partner organization and talking about how, there's a lot of food people who need some culturally appropriate food, and they're like, oh my gosh, we have so much on our shelves, let me bring it to you. And so they were super generous and kind and well-meaning, and they brought it to us, and 95% of the stuff had been expired for 2 years. Now, I eat expired food in my own home because I have choice and I'm choosing to do that. When people get expired food that we know is all okay beyond its expired date, it says something about the quality food in which you are giving out to people when people are in a desperate state. By giving food that is fresh, that is not old or spoiled, it is showing respect for community members and sending a message that they are deserving of quality food. And so in working towards providing quality food choices to community members, the questions that we ask ourselves as an organization and as the group, we ask this question a lot: is our organization acting as a way for companies to dump unwanted food? Or is it ethical to offer food that we would not eat to those who are in need of emergency food? A lot of times places get food donated that people just are like, oh, I'm going to clean out my cupboard, I would never eat that, so I'll give it to the food bank. And so I think balance our desire to avoid wasting food with our desire to provide dignified food access. And I know, no one wants to waste food. We're all in the business of food and we don't want to waste food. But that does not mean that organizations, staff at organizations, and people who come to get food at these places need to shoulder the burden of the guilt of throwing out food. And so I think we need to be a bit mindful of that as we are figuring out what kind of food is a quality food choice. And I think that leads into the next piece about respectful weight. And I'm going to start this off with a short video. And so I'm going to say this video, so we've created a series of 11 short videos that they're in the final stage of proofing. So you'll hear at the beginning, it'll say audio jungle. That's just because we haven't purchased the sound for it yet, because it just hasn't been in the final publish. So I know that you all work in organizations and you know things are in works in progress. So I think you can understand how long it takes to edit and get these things. But I really wanted to put this forward so you can actually hear from folks about this. So I am going to pull up this really short, I'm going to show you a few short videos. I'm sorry. The video is not popping up. I just showed it to you as well. Okay, if I can't pop it up, I'll have to, I'm gonna see if I can.
Is there anything I can help you with from my
I'm
end?
just gonna see if I can access it one other way.
Okay, okay.
It just wasn't pulled up for some reason. Okay, it is pulled up. Okay, I'm going to share my screen. I apologize about that. And then Courtney, you'll let me know if the volume's not up. Okay. So you'll hear the audio jungle right now.
Audio jungle.
And then
none of us are so far away from, you know, needing that helping hand. And imagine that the helping hand that you needed was for something so basic as food.
The first thing you worry about is to pay your bills and have everything that food actually comes last, because you don't want to be not paying your bills, not paying your rent and get kicked out. And then food comes last.
To have to come to a food bank must be very difficult, especially initially for people. And they may feel a sense of shame or certainly nervousness and fear about how they might be treated or viewed by needing our services. So I think it is so critical for us to be welcoming, to be friendly, to be non-judgmental.
This idea that people should just be grateful for what they're handed and that they shouldn't be allowed a choice. This idea that if you need access to food, that somehow you are like a detriment to society, as if you are not good enough to participate in the like super elitist idea of buying whatever you want at a grocery store. I think this idea that, you know, food access is linked always to poverty is, that's what keeps that cycle going. That's what keeps people feeling oppressed. That's what keeps people feeling like they're not good enough or that they don't deserve better or that choice shouldn't even be a part of it.
And then I'm just going to skip. I just want to skip to here.
Audio jungle.
I think that's like the you know, the sort of core part of human connection is respecting one another. I think when we go into spaces or into relationships or even in just brief interactions, thinking that you're better than or less than anybody creates that dichotomy of really, you know, reinforcing the ideas around who can and who can't. And for me, if you don't go into it with respect, then you are part of the problem. Like that's the bottom line. You need to have respect for others just as much as you have respect for yourself to keep a good cycle of life going.
It matters because your dignity, like you don't want to go to a place and feel uncomfortable to access food and to go into a place where people are looking at you and judging you for either how you dress or how you present yourself, and then you're asking for food. Like For instance, me, I have the colorful hair, I have the tattoos, I have the piercings, and I get judged because of them.
When you go into a store, you want to be treated with respect because you're giving money, right? So you expect them to treat you with respect. It's important for me to feel respected and valued because every human being needs that.
Do you want to be asked a million questions of why you can't make ends meet, and why do you need to come here to this second food bank? You know, you were already here 2 weeks ago. You know, like, would you want to be put through that, or would you rather somebody say, oh, did you get enough of this? Did you see that we have these today? You know, like, what would you rather? Just to think about that.
That was the one big thing that we focused on, was like how we felt when we went into a food bank. When you go into something like that, you don't want to go into it feeling like you're going to be belittled any more than you already feel. You're, like I said, you're going in to ask for help, and you want to go into a place where you're hoping that they're going to give you help.
I'm just going to go back to sharing the other, but it's. And so when we think about the respectful way, I think the three women who spoke in there who were part of our, the discussions really laid it out, is that when you go places dealing with folks who make assumptions about who you are and what your situation is one of the limiting factors for people actually getting the support and the services that they need. And so what respectful, you know, if we begin with the fact that dignified food access is as much about the manner of delivery as it is about the food itself, and that the belief that everyone is deserving of a good meal, and we trust that everyone has a reason for needing to access emergency food, then we begin to understand that it's not our place to judge whether a person is in need. If people are showing up, then they are in need. By letting go of judgments of other people, we begin to open ourselves up to respect, empathy, and when we act with respect and empathy towards community members, we can offer emergency food in a dignified way. So what does that look like? You know, it's, you know, checking our assumptions and biases and having conversations as staff at the organization, volunteers at the organization. I know that food banks that are a part of, you know, Receive Food and are part of Feed Ontario have a code of conduct that includes a lot of this language around it, that is focusing on relationships, that people, you know the people that come to see you, you know their names, you know their family members, but focusing on building the relationships goes a long way. You know, learning names of people, what their likes are, you know, if they have a cat and you have cat food that week, or if you're running a program that focuses on, you know, folks with the dietary concern, you can talk to them about it. Choice is a big piece, and I know that's shifted for a lot of organizations during the COVID pandemic, and I think we're, you know, moving back to a place where choice is actually coming back into the game. Respectful way also means no means testing, that if people show up and they need food, then we trust that they need food. Also, this no surveillance, like the feeling of being watched, you know, as opposed to like being welcomed, and then opportunities to participate. So questions that, you know, some of our local organizations here that we were asking is, do community members stand in line? Are they asked for ID every single time? Are they asked for documents every single time? Do they have choice if they want something or don't want something? If the, you know, and if there's a conflict or a way in which someone is upset, how is it dealt with? Is it in, you know, like really in the public eye, or is it dealt with in a way that people can actually have a meaningful conversation? And so we focused a lot on this way, because a lot of this comes down to the people who are there working, volunteering, thinking about their own biases that they come with and checking those biases based on their own ways in which they were brought up. And so sometimes that's a bit, it makes the ground that you're standing on not feel as strong because you're having to ask questions of yourself and see how that influences conversations that are happening at your organization. And then welcoming spaces. This is the place that we love to talk about because places are not just places. They are places that they have social meaning to them. The way the place is laid out and how communities are asked or expected to move through the place affects how the place feels. If you are going into a, down an alley, into a back lane, into a basement, it feels different than if you're going into clean, bright spaces that can help people make the experience feel dignified. We all know this. When we go into our grocery store that has been newly redone, you're like, oh, it's so bright and clean, and you feel different in it. And so welcoming places also mean meeting people where they're at. Is there a place for them to gather before they have to come through a line or enter into a program? Is the space clean and bright and open? Is there positive signage? What we're noticing here in town that there are a lot of our partner organizations are starting to remove a lot of the signs, like no backpacks, no foul language, all the things that happen, but replacing them with ways in which we want people to act. And so, because sometimes negatively worded signage creates feelings of uneasiness, unlikeliness. So, create an opportunity for welcoming signs. And what does that look like? And I will show you images of what that looks like up here. And so the last piece around this is around advocacy. And so what does advocacy look like? You might be one organization that's not connected to a whole lot of things. So what can we do at an individual level, at a community level, at a provincial, national level? And so, you're all a part of this conversation, which is the community level, about finding ways to advocate that you can have a positive impact for the whole community. So, it involves coordination with other organizations and consultation. At the individual level, it could mean connecting community members that come in with other supports. It means thinking about how supports are in place for other people that could alleviate stress and possibly reduce the need for emergency food access. And then there's the larger provincial and national, getting some of these conversations on the table. We have a provincial election that's coming up. So how do we actually get some of these conversations on the table? And there's a bunch of different working groups that are on that. I know I'm a part of one around school food. And so the handbook has all of these elements and a whole lot more. It highlights organizations in Thunder Bay that are doing this as models, because we do believe that, people are wanting to do good work, and they, that we sometimes just get we fall sometimes into what is easy, what is more manageable. And so what this looked like for us, so we created this handbook, and then the other piece that this resulted in was a huge public education campaign. So we came down to this central piece, that the human piece is the most important. You can mess up the food piece and you can mess up the space, but if you mess up the people piece, then all programs will be doomed. And so we're thinking, okay, well, what could the public education piece be around? And so we decided it was around that human piece, the rethinking the piece, that challenging your assumptions. So we, as part of this Trillium grant, we got money. So we purchased the backs of buses and, the advertising on the back of the buses. And so we came up with this campaign, and I can show you the pictures in bigger, but it's about getting you to rethink. So, where a mean meals, whatever you can get, but it's crossed out. A meal means dignity, welcome spaces, and good food. It's time to think about what dignified food access means. So just to plant the seed so people can start thinking like, you're right, a meal is not whatever you can get. It means all of these other pieces. So we have buses, we have bus shelters, and we had a series of these, this advertisement that is, food access is about food, but rather food access is about good food for all without judgment, and that people can determine what is good food for them. Or really, people should be happy with whatever they get, So we're taking things that we hear all the time in food access programs and flipping it on its head and saying, actually, really, people should have access to good food and welcoming spaces always. Regardless, everyone should have access to that. So this resulted in a whole lot of conversation for us in town with food organizations, with social serving organizations, at the local, I don't know if it's called you know, the soup and bowls thing that's happened. I can't remember what it's called, where people raise money for food banks and they get a pottery bowl and a bowl of soup. But we have conversations around food access, like it became table conversation. We also had a social media campaign. Oh, so these were all of the bus shelter ads. Just, you know, drawing them to attention to more stuff that's on the website, but just getting people to like rethink what our assumptions have been. And not to say that people are bad, but just to like, to rethink. We did a social media campaign on Instagram, because we have a lot of followers on Instagram and Facebook, to just actually get people to start to have these conversations. And then the other thing that came out of this that was a side project, and I really think it's important to mention here, is like you have your Simcoe County Food Group, we also have the Thunder Bay and Area Food Strategy. And the Thunder Bay Area Food Strategy with this Dignified Food Access Group came up with a community emergency food response plan. And I want to show you this because I really think, you know, we're all in different places in our organizations and where we're at. And I want to share this resource because I really think it's something, it's in Firefox, and then I need to share this screen. I really think it's something that, oh, it didn't come up. You know what, I'm gonna put the link. Why isn't it coming up on this screen as a possibility? Oh, there it is. And I'll put the link to this in the plan. This is like a really kickin' report that came out that's looking at lessons that Thunder Bay, a geographically isolated place, learned from COVID-19 around emergency food response. So it addresses issues around chronic food instability, but also, I'm just gonna draw your attention just to the table of contents, and then I'll put the link in there so you can share it. But what actually happened in Thunder Bay? How did organizations respond? And how are we getting prepared for building a community emergency food response plan so that we're all not stuck? What are we going to do the next time some similar thing happens? So this is a really great document for folks who are looking to do something. Yeah, we're looking to do something the next step. Like, what are we going to do to prepare ourselves for the next step about it? I think I'm at about sort of the amount that you wanted me to talk about. The videos that we have, there's a series of 11 of them. They're going to be released in the next week or so. So I'll make sure Courtney has a link to them. And each video has an example of space, you know, a discussion about what good space looks like, and then looking at a good space, and then discussion around food choice, and then what does food choice look like? And then a bunch of other resources in there, and it's hearing from people. So we're really excited for that to come out. And so I think, Courtney, I think I'm going to stop. Maybe you can take back host, or I make you back host or something like that.
Yeah. Yeah, I think we can keep it as is. I just don't want to ruin the recording. But
Okay.
What I'm thinking now, if it's okay with you, is we can ask individuals if they have any questions. They could put any questions in the chat. And I think you said you like a good question period. So we can send some your way. And I do have a few that have come up from conversations that we've had with a number of different working tables within the Simcoe County Food Council that I would like to kind of propose to you first, and then an open ask to anyone joining right now. They can put questions in the chat. So the first one is, you touched on it a little bit, but really build on a conversation that we've been having at our food banks working table, and the reason why we actually connected with you. So initially I was thinking about, like, what are your thoughts on means testing for clients who do access the food bank, which you touched on a little bit, and then The second piece is how can food banks move away from this practice while also being accountable to donors? So that's often where we're hearing from people that that is a little bit of a challenge.
Yeah, so I think those are really hard and good questions to ask. I think if you were to ask Feed Ontario, which supports most of the food banks, they are under the impression that you definitely need to collect data of some kind, you know, because they have metrics and numbers that they need to be accountable to their funders, but they do not support means testing at all. So they support the idea of there is a finite amount of food, and that finite amount of food needs to be stretched because, you know, you have enough for 5 people and 10 people show up, and what are you going to do? And how do you actually put those lines? How do you draw those lines? And so I think the way in which we approach it is with a yes, let's attitude, in that who shows up are the people that need food and they can access the food. And so the Thunder Bay Food Bank, which is, you know, one of the member groups here in Thunder Bay, they used to have, you can only come once a month to their food bank, and you have to register and only come once a month. And they've now gotten rid of that. And during the pandemic, and they're now open twice a month, and you can come twice a month. And the only information and data that they keep is the stuff that through the Feed Ontario, you know, the online portal stuff that they need to keep the tracking through them. And then when they're donors that are donating to them, they don't necessarily, their donors don't actually want to know like people's incomes or where people are at. They want to know that food is going to people and families in need. And I think they're beginning to ask different kinds of creative questions of their members, of like, you know, every 2 months they're asking questions about like, did you use the food that you received? Yes or not? Yes or no? And why not? And then they're finding that people have cupboards of chickpeas and cupboards of lentils that they will never touch because it's not a part of their diet. So how do they begin to switch into the foodstuffs that people actually really want? And so they're one of the member organizations that are realizing they're getting a lot of newcomers. So they're spending money buying halal meat as they also get donations of other types of meat to try to meet people where they're at. And so by asking questions about people's experiences and the foodstuffs that they need, they're finding that their donors are actually increasing because they're actually meeting people where they're at and what they want, not what I think they want. I love chickpeas. I love lentils. It's great. Most of my kids love them. It's a simple, easy meal. But I know that many of the people, like I go into one of the other food banks and it's like shelves of things that, you know, we all have that, shelves of stuff that people don't eat, but are there just in case. But really the just in case stuff, it doesn't always cut it.
Mm-hmm, absolutely. And I like your point around asking, it's almost like asking the right questions to get a better sense of how you're serving your clients. So that was great. And it leads me into another piece that we've talked about in other groups, including the food bank working table, is at the end of the day, the root cause is poverty, right? That people are needing to access these emergency food services, or as some other groups refer to it in Simcoe County, temporary food relief. And something that we've been reflecting on is how do smaller organizations engage in poverty reduction work or advocacy work around this area. So you touched on a little bit around advocacy in general, which is great. And so I would love to hear if you have any thoughts around advocating for poverty reduction or poverty elimination while doing this work.
Yeah, so I think we bring up and talk about that all the time. So when people call us up and they ask us questions about food prices in the North, we talk about, yes, the reality of food prices in the North, and it always comes back to poverty. We have this case example here in Thunder Bay, right? We were one of the basic income pilot sites, and we noticed, there's been a couple of studies, and we've noticed a real significant impact that had on people's lives. So we can very easily fall back to the data that's there, and the data speaks it, even though it was a super short, like sample size and time wise, that we always bring it back to issues related to poverty. And so we use the platform as much as we can to talk about it and learn more about it. You know, I'm sure you're all privy to the Proof website that has a lot of really good information about it. And I think, you know, Courtney and I were talking before, the Ontario Dietitians and Public Health, I think it's the ODPH, they came out with this really phenomenal document, December 2020. And it was like kind of their first big bold statement of saying it is about like food access. It's about poverty. We need to address the issues of poverty. And it's not just about people going for the quick fix of food. We need to look at the root cause of food insecurity, of being around poverty. And so it's being talked about at all different levels, in school food, in the dietitian world, in public health. And so that conversation just continually needs to happen.
Yeah, absolutely. Definitely has to be a big piece of shifting the culture in organizations or the work that people are doing. So that's great. And we do have a few questions here that if you're good, I'll ask them to you, Airin.
Yeah.
So first, Nikki just said, or not just, she shared that was a great presentation and commended you and your team on the work that you're doing. And there was a question from Nikki. So what type of progress do you feel has been made in reaching those food insecure households to reach out and ask for help? First time users, as we know, there are far more households silently struggling that never reach out to ask for help. Have you been able to track this?
Oh, Nikki, that is so hard. I think what we have and other, partner agencies are doing is they're trying different avenues to reach people with food. So if food banks aren't someone's food thing, then, it's through the school nutrition programs and what's happening within the schools, or it's happening within, the mom and tots play groups and their cooking programs. It's just trying different avenues all the time, because there will be people who will never, ever, ever come to a food bank. And so I think trying to find other ways to find those people is the key. So, we are partnering, our organization has partnered with, so Elevate Northwestern Ontario is an HIV Hep C organization. So we partner with them to do food access work. We partner with eFry, which is an organization that works with women who are leaving or at risk of being incarcerated. And so we're doing food programs with them. We're doing food programs with kids who are expelled or suspended in those areas. We're doing food programs with the attendance counselors with the schools. We are going into communities. What we find is expecting people to come to us doesn't work. We're going out all the time. So when we work with eFry and try to get food out to the women that eFry might interact with, we are going to the parks that they hang out with, and we take our mobile team and we set up out there, and maybe we partner with the local community health center that can do a needle exchange at the same time. And so we find that partnerships is the key to reach people. Expecting people to come to you is not necessarily going to work. And we, in our city, where the bus transportation is abysmal and it's so spread out, so we find going into neighborhoods and making partnerships with people that might not be the most likely. We've also partnered with our local legal aid, recognizing that so many people can't even register for food banks that don't have ID. And if you don't have ID, it all starts at your birth certificate. So we're now offering once a month birth certificate clinics. So people come in, we help them fill out their forms. We've been able to leverage funds through Legal Aid Ontario to pay the $35 for people's birth certificates to help people access ID so they can access services. And so it's, again, that partnering with other agencies so you're not doing it alone. And that's hard if you are a volunteer-run organization and you're doing a whole lot of other things. And so what we try to do is we actually try to pay people. We try to fundraise to pay people so that they are getting that experience of getting paid, maybe getting them back into the workforce, maybe not, but valuing their time and their money.
Thank you for that. We have another question. So this one's from Shannon. And the question is, I was wondering if you could give a few examples of how people could be given opportunities to participate. It would be appreciated if you could speak to anything beyond providing surveys or talking to those who utilize the service.
You mean participate in the conversations? If that's what I think, maybe that's it. So participate maybe in the conversations, I think, Courtney, is that? That's
how I read it. And I'll see if there's any further comment. Yeah, Shannon, you feel free to add in anything else, but let's make that assumption right now.
Yeah, I think, like many of the organizations that you all represent, we're in a smaller place. We're quite well known and we're quite well respected. And so often we meet people where they're at, and we have food and we have childcare and we have bus tickets and we have conversations, and we provide so many different kinds of opportunities for people to get involved. And so like the emergency food response plan, they did a whole bunch of surveys and they gave people like $10 gift cards as a $10 gift cards to Tim Hortons as a thank you for filling out this survey, right? So there's some sort of piece to that. But we find that going to where people are, partnering again with other programs, they might be a bit, bringing food, and also just interacting in a way that's like full of curiosity and valuing their opinion, and then coming back to them to say, this is how what you said made a difference. That really works for us. There's always going to be people who don't want to interact and engage in that way, and that's fine. I think in all different realms of life, there's people who participate and people who don't participate. And so the other thing I would say is we as an organization, and many of the other organizations, try to find ways to like hire people and pay people and to value their work. And so I don't know if that really relates to like doing surveys so much, but we find that we meet people where they're at and have conversations. And sometimes it's drawing pictures, and sometimes it's engaging with their kids. But it's, I don't know. We just were in this morning with our staff team. We were trying to design our survey questions for our summer employment program. And the default is always to come back to surveys. And it's like the easy comfort place where you get the most of your answers, but I don't always know if it's the best way. So I think organizationally, we're also in a place of just trying to figure that out, but.
Right. And Shannon did provide some clarity. She just said, so I run a food program where we give them a weekly bag of food. How can we allow those families the ability to participate in what they are getting, other than providing them with a survey or taking with,
or talking
other than providing them a survey? Yeah, or talking with them. Yeah.
Yeah, so one of the things that we did during when COVID first hit, we did it for 2 full years. So when up here in schools closed, the school nutrition program up here in the schools is run by the Red Cross. And so we partnered with the Red Cross, meaning they gave us all the money, and we created these food bags that went out to kids and families. So it was about $40 worth of fruits and vegetables $25 to $40 per week. We've partnered with the Northern Fruit and Veggie program too, which is, I don't think you guys are a part of the Northern Fruit and Veggie program, but it's run out of the food terminal in Toronto. And they bring fruit and vegetables to northern places. I think it's actually anywhere from North Bay up. Like it's a really huge geographical area. And so we would get that fruit and vegetables and we package it up and we would take it. We had 20 different partner locations where we actually met people and handed out bags. We did it for 30 weeks in 2020 and 40 weeks in 2021. So we were packing a ton of food and moving a ton. Our whole organization changed under this. But what we found is that we had to meet people where they're at, and we had to talk to them to find out what they liked. And that's when the parents would say, my kids won't eat. If you give me a 2-pound bag of big giant carrots, they won't eat it. But if you give me baby carrots, my kids will eat it. And if you give me 3 tomatoes, my kids won't eat it. But if you give me a clamshell of small tomatoes, my kids will eat it. And they don't like apples, but they like mandarins. And so like, we just had our organization, like we love feedback. Like we want to find out what people are eating and then just ask the questions. I don't know how else you would find out what they want without asking them. But I would say the given is like the most expensive stuff are the eggs and the dairy and the cheese and the fresh fruits and vegetables. And so we found those food bags were almost like never packed with like crackers or bread, because that's the stuff that they can get at their corner store. But we always gave them more stuff that they wouldn't be able to afford or take a risk on buying. Like what happens if they buy a $5 clamshell of raspberries and their kid doesn't like raspberries? Like it's big to take a risk on that much. So.
And I think just like you've shared in this presentation is having those conversations with them, because that's a dignifying experience, just asking them, hey, how's it going, right? Yeah. So yeah, that was great. Thank you. We have another question. So this is from Heather. When you mentioned encouraging agency volunteers to become aware of their own biases, what are some approaches you use to have those conversations? Is there information in your handbook about that?
You know, there in the handbook, there's some like guiding questions. I have heard of like, you know, 2 really good resources that people use. So I know that Feed Ontario has a code of conduct, and I know that local food banks here look at that code of conduct and do trainings on that. If you're a food bank, you fall within that, right? Like you have to be able to do that. And so what I've been told is up here is our local Feed Ontario person is like, everyone who's a part of it should be doing this. And so, and I've heard it's well received. I know a number of food banks up here that go through those conversations, and you know, they often get the Feed Ontario representative to come in and to help facilitate it, because some of those conversations are harder to have. And then the second is, I don't know, there is through Community Food Centers Canada, they offer, and again, this is food bank specific, they offer food bank training where it's like, I think like, you know, a few members from your food bank do this training. I think it's like, maybe someone on here has done it. I feel like it's an 8-session conversation that you can have about a lot of these topic areas, and you can go into more in depth and then have tangible actions that you can bring back specifically related to food banks. And then I would say the third thing is like, you're all in organizations, like volunteer capacities. I feel like, you know, at the time where it's like the strategic plan or the places where you need to have those conversations, you just need to start them. You just need to start the conversations. And so, I don't know, it's Ramadan here, and I'm working with a staff team, and 8 of them have no idea what Ramadan means. And so I'm like, great, let's have a conversation. Let's sit together and have our morning tea and just have a conversation about what we know, what we don't know, how are we going to approach it. And so I just think it's about starting. Sometimes I think these conversations, it can feel like it's so hard to navigate and so heavy. And what if I say the wrong thing? And if you approach conversations with care and compassion and curiosity, it's never the wrong thing. And it's just about having the conversations.
Yeah, thank you for that. Almost like needing those prompts for an organization to kind of have those uncomfortable conversations or important ones. Yeah, that's actually a good reflection for the Food Council to look further into connecting with Community Food Centers Canada around that, just to see if we can provide support for organizations.
Yeah, I just know that here, a few food banks up here have taken that training and have just said it's been really great to how they structure, how they organize.
Okay.
As opposed to thinking like, oh, someone with a specialized diet is coming through the food bank. Oh, how are we going to deal with that? To just say like, this is an opportunity to meet people where they're at, because often these specialized diets are really expensive and hard to access. Yeah,
definitely. So we have just 2 comments from Christine. So she is with the Simcoe Muskoka District Health Unit. So Christine sits on the Simcoe County Food Council and works with other organizations or partners with other organizations. And they help lead the No Money for Food is Senseless campaign. And so really looking at those root causes of poverty, which is the root cause of household food insecurity. And so one thing we've also been chatting about is how we can have more of these conversations in organizations. So one thing I'm going to do in the summary email that everyone will receive today is include contact information for Christine around, and maybe Christine can jump in a second, to have her team come in and have these conversations with your teams, your volunteers, your boards, just to provide more context and paint a better picture of what is happening. Christine, did you want to speak to that?
Sure. Thank you very much, Courtney. I really want to thank Airin for her presentation and let you know, Airin, that I'm really impressed that in your document you have a whole section on advocacy, because that is really, really critical. It's important that we certainly provide food in situations where there's chronic food insecurity or people need food in an emergency situation. Absolutely critical that we do that, and absolutely critical that we do that in a way that preserves dignity. So thank you for the handbook and thank you for the presentation. In terms of the advocacy component, you're absolutely right. We really need to end poverty so that people don't have to access food in ways that are really not very dignified. Even if they're treated the best and with respect, people still feel badly about having to go to emergency food programs. And you're right, they've also exhausted all of their other options. Like they've tried absolutely everything before going to a food bank or a meal program. So we really, as a community, we need to kind of stand up and end poverty. And I commend you for having that information in your handbook, because that is really very, very critical. And the Food Council as well is doing a lot of work to start advocating for an end to household food insecurity as well. So I wanted to thank Courtney for that as well.
Thanks for that, Christine. And we just have a comment. Oh, someone was just sharing that they do something similar when we were talking before around food programming. So they do good food boxes with families every month from local growers, along with recipes and different things like that, trying to get that, providing that dignified access through understanding their preferences and things. Great. And just wondering if there's any other questions, and if you didn't want to write in the chat box, and if you wanted to raise your hand and just ask a question on camera, you're also welcome to do that. And while we're waiting, I will just say that I did include a link to the evaluation that we kindly ask you to complete. And it will help us understand what you took away from today and what you would like to see in future sessions to help, help the work that you're doing. And if you're unable to do it today, or you forget to click the link, we will make sure to include it in a follow-up email as well.
And maybe while folks are thinking, I can just add this, like, as people are planning their summer vacations, if your summer vacation includes a drive out west that you stop in Thunder Bay, you should come here and I can tour you around so you can see some of the different programs. I think really these exchanges are super important for people to see what is happening in different places, not only for us to say, oh my God, we need to definitely change this and learn from other people, but also to just see what is possible and to feel like you're not alone in this. Because sometimes like this is really like exhausting and hard work that you invest so much of your life into. And so I think it's good to get filled by other possibilities and people are doing something. So if you come to Thunder Bay, I will show you around to show you some really interesting, fun, inspiring things. And then I just saw, I was like looking through, I was like, ooh, someone here is from Newmarket. Everyone here in the north, their doctor, we don't have, you have heard probably, there's doctors, no doctors up here. And so my doctor's in Newmarket. So I fly down every 2 months to see my doctor. So I might find the person in Newmarket and say, hey, show me what you're doing. Because I think these exchanges are super important. Like, it's so great that you have this group like in your region, but I think getting out also to see who is doing what where, it just leads to other conversations and ideas. So
I think that's a good segue for another question I was thinking about is in terms of partnerships, what are some, you touched on a few that were really unique. So some key partnerships that you and your group have had, and some organizations that anyone here can think about working with that maybe we wouldn't necessarily consider as like that optimal partnership that we would go to.
Yeah, I think we just follow who we see and who's asking for support. And so what we noticed, during the pandemic, there was a lot of seniors, the tea and toast crowd, and the elders, the Indigenous elders that were really like stuck in their home. And so when we're opening as a community food center and have a community and having our food community meals, our initial target group will be the seniors and elders and having culturally appropriate foods. And so one of the interesting things that we've been able to do is that if you're serving wild or country foods, cultural foods, moose or deer or goose, you need to have a specific allocation, a wild game permit through the district health unit. And so we have partnered and created a really close relationship with the district health unit that has allowed us, we actually have a blanket permission for the year, and then we have to renew it every year to serve wild game in a particular way. We have a specific freezer, a specific fridge, specific cooking utensils that we serve, like cook and serve our food on, to be able to meet people where they're at, to have food that is appropriate to them. So that's been a really interesting partnership to think, okay, when we open up and do community meals once a week, we're doing it for elders, you know, the local conservation authority, all the moose and deer that they confiscate that have been illegally hunted, they come to us in our freezer, and that we then will serve them during these meals that we work in close relationship with the health unit on. And so it's really interesting, you know, those kind of partnerships, like seeing where the possibilities are, and to not say, oh, this is going to be such a hassle, to just say, how do we make this easier? And so now then our local shelter in town, they've also got the blanket permit to serve like wild and country foods. And so there's a lot of, like, I think that's one of the real great things about being isolated, is that you really need each other and you need to work with each other. And so it's not like we're all like posturing and fighting for our place. It's more of like, how do we do this better, and how do we work together to do this better?
Yeah, that's wonderful. Like shifting from that like scarcity mindset to that abundance mindset. That's great. So we have hands up. I just wanted to confirm, Christine, is that an old hand that's up? We're used to this happening in meetings, so I just wanted to, yeah, okay, wonderful. No worries. Oh, sorry. Okay. Nikki, you can go, and then Christine, if she wants to go.
Great, thank you, Courtney. Thank you so much, Airin, for your presentation today. It's very inspiring to see what you have done up north in Thunder Bay. I wanted to talk just quickly about your phrase, meeting people where they're at. To me, that resonates on two levels, emotionally, but also physically meeting them where they're physically at. Could you speak a little to how, like what element of providing drop-off services to people's porches and stuff played during the pandemic, and maybe will continue to play going forward? I know that is a gap that we've noticed with whether it's seniors or people on ODSP who have physical limitations to be able to get out and about, or depending on their geographic location within our city, their access to bus routes and stuff.
And I feel, Nikki, that's such a great question, because I feel like it was actually a big issue before the pandemic hit, but it just was never really spoken about. Like, I think it always like left people not able to get things. And I think what has emerged here is a network. And because things are so coordinated, like through 211 and our umbrella organization, the RFDA, to get food out to people. And so often when people call and need food or are identified, there seems to be this like network of people that are always trying to do that, like to figure out how to get food there. And I think very rarely does it come down to like me going and taking food somewhere, unless someone calls me at the like right moment where I feel like I have the 20 minutes that I can go do that. Like, we don't really do that. But there emerged for us a network of people, either connected through the Salvation Army, the RFDA, like the big umbrella organization, or to be honest, our child protection services. Like, we have 3 of them in town, Tikanagan, Dalico, and Children's Aid, Thunder Bay, who that we just referred people to connect to. And they're like, actually, we have this staff right now that are driving around all the time. We can do this. And so it was about, again, these kind of like unlikely partnerships, and not just like one individual food bank or one individual program that could do it. And so, and then I think, you know, what also emerged was people like began, I think it became like a paid position for a few different agencies. They came across some funding that could do that. So, but I think it's a huge problem. As much as like people are getting the food, there's still a lot of people who just aren't calling because they just don't even know that that's a possibility. And so I think like with the kids' food bags, like what we're finding is that people, like, you have to go closer to where they're at. So, you know, a few of our, like when we went down in the beginning of the pandemic, we went down to one food bank, one central location of food bank that was like in a big parking lot of the movie theater. And so everyone had to get there, and it was a total disaster, because that was a time when like you weren't supposed to be sharing cars, you weren't supposed to be going on the bus. And then people were taking all of these boxes and they had no idea. And it was snowy and no one could get anywhere. It was like a real disaster. And that's when the real big push to like reopen in locations that are closer to where people are. And so I think that's been a real big push for people to reopen. But the whole, I don't know what the solution to the whole driving piece is outside of like organizations that are already driving and can add it to it. It's, I don't know. What have you tried, Nikki? I don't know, maybe you probably have better solutions than I do.
Well, we're a very new agency here in Barrie, but and we came up as a result of the pandemic and then have evolved into now a not-for-profit of our own, but really with the purpose of trying to fill the gaps between agencies that we noticed percolating to the top repetitively. And I think you're right. I think a lot of these gaps existed prior to the pandemic. It's just that that happened to be the birthplace of our group. So because we've only been in existence since the pandemic, we've been a very much porch drop kind of a system. So we have an entire fulfillment process now in place where requests for assistance get processed. We put a list together every day, it gets sent to the warehouse team fulfills them. We have different drivers that come in every day and do the drops. We're not in a position physically right now that is a welcoming center. It's a warehouse with ceilings that are 40 feet high and cold and not particularly accessible via transit. But so it's working for us now, but I'm just picturing a future of how it could be done better and have that flexibility of options of trying to meet people where they're at, but also stay true to the ability to properly serve the people that just can't get out for a variety of reasons, whether it's you have 5 kids and under the age of 7 and you just getting anywhere is a nightmare.
Yeah, and I'd say like if you're rural based, like up here, gas for us is $2.05 right now.
Yeah.
So like filling up your car is really hard for folks. And so I think that's going to be a new thing. Like it was already expensive when it was $1.40 and we're now above $2. And so I think that's going to be another piece of getting people. Yeah. But that's again, why we, partnered with the attendance counselors at the schools to be able to get things. They're already going to families anyway. So that, we partnered with a whole bunch of people that will be going to those, single family, like single parent households of 4 kids. And it's just so hard. And especially during the pandemic, so many of them were shamed from like getting on the bus or going grocery shopping and taking their kids, but they really had no other option.
Yeah.
So,
yeah. Well, we keep plugging away, right?
Yeah. Well, I'm glad you're filling that gap. That sounds great.
Thank you.
Thank you for that. Christine, did you want to share anything else?
No, that's fine, Courtney.
Okay, great. So I'm just looking at the chat. And so Airin, you have open invitations to connect with organizations in our area. So definitely take the people up on that offer if you're down in Newmarket again.
Totally. I will.
And I'm just seeing a comment from Melissa. So at the Sharing Place Food Center in Aurelia, we created a social prescription to fill that gap and allows for health. Oops, my thing just jumped up there. Sorry. Health practitioners to recommend delivery. So again, finding those unique partnerships. And another comment coming in from Louisa. You're all part of wonderful organizations, and it's amazing to see what we do. We are only St. Vincent de Paul volunteers who drop off food cards and good food boxes and limited special needs financial assistance, and our income is parishioner donations only. But I'm thrilled to have been able to log into this and hear more. And St. Vincent de Paul does join our food bank's working table, and they have been partnering with the local food bank as well.
Yeah, and I know there's more than, people around like getting food, like food banks. There's all these other programs, and I think they're all coming back online. And I think this like community kitchens and, Good Food Box, I think has morphed in many different ways during the pandemic and, employment programs. And I would really say this is, it feels like coming out of whatever, I don't know this language, coming out of the pandemic, it's like a real opportunity to try something new and to figure out a new way. And we're trying that up here, and it's a lot easier to just do the same old thing, but it's also fun to try something new, to be able to like really incorporate advocacy into all things that we do. So if it's the interactions, the one-on-one interactions, if it's the bigger, in our community, or we have this election coming up. And so what does that actually mean? And so I think I would say this is a really good moment for folks to have those conversations.
Yeah, absolutely. And a good reminder for us at the Simcoe County Food Council, we're working on a provincial election toolkit for the upcoming election with key recommendations, but also some tools for anyone attending here and anyone in the county to be advocating for income solutions, school food and food literacy, and agriculture and local food systems, and knowing that it's really important for our organizations to be advocating on these issues, and also getting our clients, our participants to be getting out to vote as well. That was another thing that came up through our conversation. So I will say that if that's something that you're interested in, do join our newsletter, and if you sign up for that. And so we will be releasing the toolkit in the next few weeks, as well as having a page on our website to better understand the key issues and what we're asking of the government. And so I am being mindful of the time. Oh, I'm just seeing if there's anything else that came through. Okay, yeah. Working collaboratively and together. So definitely a theme today. So I am being mindful of the time, and I'm sure we all need to go to our next commitment, but I do want to take the time to say thank you to you, Airin, for first having a few conversations with myself to see if this was a possibility. And then secondly, coming today and bringing this to life for everyone joining. Really, really important topics and things to take away. And for us, at the Food Council, and for all these relationships that we have, how can we start planting these little seeds and make this happen countywide? So, and thank you to the work that you and your team are doing. Really, really valuable.
Yeah, thanks for being in conversation. I think it's great.
Wonderful. Well, thank you everybody so much for joining our first table talk. I think I would say it was a success, which is really exciting. And we have some great ideas for our next session, but also we've given an opportunity in the evaluation to let us know what you want to talk about more. And I've also jotted a few notes down from Airin's conversation about things that we can be looking at to help support the work that you're doing. And of course, if you ever have any questions, feel free to reach out. We love chatting. So have a great day, everybody.
Yeah, thanks for organizing this, Courtney.
Yeah, thank you so much, Airin.
Thank you
Bye,
both.
everybody.
And I'll just end by saying I'm glad I'm home. They just closed the highway. So
Oh my goodness.
I don't know. I don't think you can really see the amount of snow. You can't, but my deck the snow is higher than my trampoline in my backyard.
Oh my goodness.
So I'm home now. I'm very happy. And I just want all those pictures I see of you guys posting crocuses and getting in there. I just want that to happen.
Well, we're also grateful that you're safe, and also that your internet did not go out on us.
Great. Thanks,
Awesome.
y'all.
Thanks so much. See ya.